I'm Gary Schultens, and I had robotic prostate surgery at ThedaCare Medical Center in Berlin. The past year and a half has been tough. My wife found out she has endometrial cancer. Once her treatments were done, we thought, okay, we can maybe find out what normal life is supposed to be. Then I got diagnosed with an aggressive prostate cancer.
Gary's first symptoms were from an enlarged prostate. We ended up treating his bladder stones and doing a procedure for benign disease of the prostate. While his PSA prior to the procedures was very normal, it started to have what we call an elevated velocity.
So finally he said, I think it's time to do the biopsy. And I said, okay, we'll do that.
Gary did have prostate cancer on the biopsy. It was of the form that in time could threaten his life.
It's that whole path that you try to go down and wrap your brain around this. Then you ask why, and then what do we do next?
Given Gary's age, overall health status, we did recommend a robotic prostatectomy. It allows for minimally invasive surgery in hard-to-reach places. He was home the next day, and we had him walking around that week. He came in for his catheter removal just days after the surgery.
He came back and said, the PSA is undetectable. The exact words, he looked and smiled at both of us and says, that's freaking amazing. I'm doing great, back walking, I've done some running. I plan to get back reffing high school soccer in the spring. The opportunity to be able to come back and do those things again and not have the worry hanging there, that's great.
The problem with prostate cancer is it's often a silent thing. So it's something that you should talk to your doctor about, getting routine examinations, which include the blood testing, the palpation of the prostate, and those two together screen for prostate cancer.
ThedaCare as a whole has been great. The quality of care here, and not just Dr. Maes, but all the nurses, other doctors, for a town this size, we've been totally impressed.